Hi guys, Assalamu alaikum.
We will start the, the phases of cardiac cycle. Our cardiac cycle, it is consisted of two phases. The first one is systolic phase, and the second one is diastolic phase. And then the systolic phase, first of all, remember the time period for systolic phase. It is about 0.3 seconds, very short and very fast. And for diastolic phase, the time is 0.5 seconds. It means our heart completes one cycle in total of 0.8 seconds. Now, in systolic phase, we have three subphases, and the first one is isovolumetric contraction phase. Isovolumetric contraction. The second one is rapid ventricular ejection. Remember this word, ejection. It means heart is pumping. And the third is slow ventricular ejection. This was systolic phase. Now talking about diastolic phase. Diastolic phase has four subphases. The first one is isovolumetric relaxation. Sorry. The second one is rapid ventricular filling. Now we have this difference. In systolic phase, the ventricle was ejecting the blood out of the ventricle, and in diastolic phase, the blood is coming inside the heart. It means the ventricles are filling with blood. So the third subphase is slow ventricular filling, and the fourth one is atrial systole. This one is for atrium. First of all, for systolic phase, we have the first one, that is isovolumetric contraction. In isovolumetric contraction, the first thing that happens is ventricles start contracting just to push the blood out of the ventricles. The second change or second thing that happens in isovolumetric contraction, no volume change, because all four valves are closed. this is the main point of this. Iso means same, it means there is no volume change. The third thing that happens is production of S1 hard sound. In our next lecture we will study about the hard sounds S1, S2, S3, murmurs and others. And the fourth thing that happens is there are two components of S1 hard sound. And what are these two? The first one is the sound produced by the closure of tricuspid valve, and the second part of the sound, S1 sound, that was produced with the closure of mitral valve. Remember one thing, always the sound will produce with the closure of valves, not with the opening. And now the second part of systolic phase, that was rapid ventricular ejection. It will take only 0.1 seconds. The changes or the things that happen in rapid ventricular ejection phase are, first of all, ventricles continues to contract. Second thing is, because these ventricles are contracting, so the space is getting lower or lesser, so that's why the pressure will increase. You can say that for left ventricle the pressure will be 80 to 120 mmHg, and for right ventricle that is nearly 8 to 25 mmHg. This is for normal, because we are not reading pathology, so we will talk about the normal things. The third thing that happens in this subphase is opening of pulmonary and aortic valves. Now the question is, why these valves open? And the answer is because the ventricles are contracting continuously. The pressure is increasing. Here you can see that when the pressure is increasing, ventricles are contracting, so that's why these pulmonary and aortic valves open. And the fourth thing that is going to occur in this subphase is ejection, because the valves are open, so that's why the blood will eject into these greater vessels. Ejection of blood from ventricles. Okay, to pulmonary trunk it is towards lungs, and the second is aorta. Now, if you remember, in our last class or in our last lecture, we studied about systemic and pulmonary circulation. This was lesser circulation, this was greater, because it is going towards our lungs and this is going towards our whole body. Okay, our third subphase of systolic phase, that was slow ventricular ejection. Still it is ejection. It means in this phase also the blood will eject and the blood will goes out. The first thing that will occur or that will happen will be 30% blood enters into greater vessels. Okay, in this rapid ventricular phase, 70% of blood, you can add like fifth point, this was the fourth, 70% of blood will eject and enter into greater vessels like pulmonary trunk and aorta. You can say pulmonary trunk and aorta. Okay, here the remaining 30% blood enters into great vessels in slow ventricular ejection phase, and the second thing is in this phase, just before pulmonary, let me remember that, pulmonary and aortic wall closure. In this period, just before the pulmonary and aortic wall closure, the pressure and volume are at their peak. It means max pressure, max volume. The volume will be 60 ml and the pressure in left ventricle, it will be 120 mmHg, because it have to eject blood towards the systemic circulation, or you can say towards the body. And the pressure in right ventricle, it will be 25 mmHg. So if you can write, you can note, but there is no need. Like atrium are relaxed, they are doing nothing in this period, so that's why the pressure will be 0, because they are relaxed. Or for aorta, the pressure is 120 mmHg, and for pulmonary trunk, the pressure will be 25 mmHg. You can say max pressure in this phase. This is important for MCQs. And now we will talk about the diastole and the subphases of diastole. The first one was Volumetric Relaxation, and it takes 0.1 seconds. What is going to happen in this phase? The first thing that happens is ventricles starts relaxing. The second thing is pressure, and the question is how much will be the pressure. So pressure in left ventricle will go down from 120. Before in systole that was 120, and now it will go down from 120 to 0 mmHg. And in a right ventricle the pressure was 25. Now it will go down to 0 because when left and right ventricle, these are going to relax. They will relax just to fill the blood. Okay, the third thing that will going to happen in this phase is closure of pulmonary and aortic wall. Now if you remember, I said the heart sound will produce when the valve will close. So S2, the fourth point is production of S2 heart sound. Happens in this phase, and that S2 has two components. The first one is aortic wall closure, and the second is pulmonary wall closure. You know, this will be a little bit earlier. So if this sound is a little bit earlier and pulmonary will be a little bit late, so that's why there will be splitting. There will be two sounds, not one, there will be two sounds. So you can add a point that splitting, yeah, you can say splitting of S2 occurs here. And the second subphase was rapid ventricular filling. It also takes only 0.1 seconds. Sorry. So the first thing is opening of mitral and tricuspid wall. So I said the sound will be produced when a valve is going to close, or the sound will produce at the closure of any valve. But here the valves are opening, so there will be no sound. Okay. The second point is the ventricles continues to relax to fill blood. The third thing is pressure in ventricles, and the question is what will be the pressure. So the answer is in right ventricle pressure will be 0, in left ventricle the pressure will be 0, because these are relaxing just to fill the blood. These are not contracting. The pressure will be produced when the ventricles are contracting. The fourth point is rapid ventricular filling will produce a sound and that sound is called S3 sound, heart sound you can say. Due to rapid filling, like if you are filling something rapidly, like if you are putting water in a bottle, if you are filling something with any liquid, the sound will be produced and that will be S3. And now I'm going to explain. Like this sound is present normally in young and healthy person. I hope you know the reason. And the sixth point is that was normal and now abnormal S3 sound is produced, and the causes are, the first one is congested cardiac failure, the second is any kind of anemia, the third one is hypothyroidism, the fourth is fluid overload. Okay, you can say IV infusion or chronic kidney disease CKD. In diastolic phase, the third subphase was, sorry about the paper, slow ventricular filling phase. And remember one thing, for MCQ you can write MCQ that this phase is longest phase in cardiac cycle, and the duration is nearly 0.2 seconds. The second point is slow filling of ventricles. Third point is 70% of blood enters in ventricles in both phases. Which these both phases? The rapid ventricular filling phase and this slow ventricular filling phase, and these combinedly In these two phases combinedly, only 70% blood enters into, you can say, our heart. 70%. And the fourth diastolic subphase was atrial systole. Atrial systole or atrial systole. What are the changes that we will see in this phase are, first of all, very important for MCQ is P wave appears on ECG. Second, the remaining 30% of blood enters in ventricles. The third point is the atrial systole is not so important for ventricular filling, but still it you can say, of course, contributes. And the fourth point that is very important is production of S4 heart sound. You can say due to atrial systole or systole, whatever you want to say. This S4 is normal only in old ages, but it is abnormal in ischemic heart disease and congestive cardiac failure. So I guess we have finished our phases of cardiac cycle. In next lecture we will continue the heart sounds.